On today's episode of Dr. Dev's Anti-Aging and Wellness, we're going to talk about facial rejuvenation. And looking good helps you feel good. It makes you feel better. And feeling better is part of wellness. And this is all what we all want, to look good, feel good, because this is basically why patients are spending billions of dollars on the stuff that I'm going to talk about, because it makes them feel good. When they feel good and they look good, people react to them differently, and patients understand this intuitively. So when patients come in for a consultation, I look at them and I try and explain to them what needs to be done. And in this episode, we're going to talk about volumizing the face. What people often come in and say, I want Botox, and they're using that as a shorthand for I want to look better, because Botox was the first treatment that actually worked. But this episode today, we're not going to talk about Botox. We're going to talk about volumizing the face, because that is what causes the appearance of aging. So I've brought you into my treatment room because in my treatment room, I have pictures, and this is what I show patients. This gentleman, you can see how hollow his face looks. And what he really needs is volumization of the face. And this I did in an hour. That's why it's called a lunchtime facelift. And I did that by tightening the skin with what is colloquially called threads and Sculptra. Most of the time, people talk about the hyaluronic acids. And that is the most commonly used filler. Fillers can be used to smooth out the lines in the nasolabials, underneath the eyes, and to enhance the jawline. So these are the many different places. In this patient, we've volumized the chin to restore facial balance to the face, and you can see this by balancing the chin. She looks completely different and much happier after doing that. The different types of fillers that are available in the United States today, and why we've come such a long way in terms of fillers. The first filler that was used in the United States was collagen, and it was very difficult to use because it came from bovine collagen. You had to test the patient to make sure that they were not allergic to it. And then when you injected it, which was primarily in the lips, it tended to be lumpy. So collagen was not a long-lasting treatment, because pretty soon patients and doctors realized that this really doesn't work the way we want it to work. Then about 20 years ago, the hyaluronic acids were discovered. And what hyaluronic acids are is they are a natural substance. Your body actually makes hyaluronic acid, and it also makes an enzyme called hyaluronidase, which breaks down the hyaluronic acid naturally. So what pharmaceutical companies have done is they have created hyaluronic acids in the lab, and they have tweaked them to make them more resistant to hyaluronidase. And that is why when patients ask, how long does this filler last? The answer is always that it depends upon how much hyaluronidase you produce. It has nothing to do with the brand of the filler. It has nothing to do with how I injected it, because the way it is metabolized, it is through your own body's hyaluronic acid. So we're going to talk about the different types of fillers that are available. The majority are hyaluronic acids. They come under different names from the different pharma companies, and they have all been tweaked slightly differently so that they have slightly different properties. And those slightly different properties are of interest to the doctor who's doing it, because those differences in properties primarily relate to viscosity. How thick is the hyaluronic acid, how difficult it is to inject, and the flow out of the syringe, which makes it easier or more difficult to control the placement. And the technical name for that is rheology, the flow of how the hyaluronic acid flows out of the syringe. But when patients come in, they really have not, and we're not going into technical details in this podcast, except to say that when patients come in, they say, I want Juvederm or this other filler. And I ask them, why do you want that? And they say, well, I saw it advertised on TV. And so it's driven largely by the patient demand. And then, of course, there's marketing so that individual companies can try and come and say, you should stock this because we have a $50 million advertising campaign going on for this particular hyaluronic acid. So in my opinion, there's actually the difference is of interest. So if I'm injecting fillers into the lip, I want a filler which has good flow characteristics, which enables me to place the filler accurately. So that's one category of filler. And the wonderful thing about hyaluronic acids is that if you don't like where you put it, you can inject it with hyaluronidase and the filler will just disappear immediately. So it's something that you can almost experiment with the patient and say, how do you like this? And if you don't like it, you can put some hyaluronidase and change it. Because some of the other fillers are not like that. So there are two other fillers in common usage in the United States today. One is trademarked as Sculptra, and it is actually polylactic acid beads. And this, the benefit of PLLA is that it is biostimulant. It lasts a long time and it stimulates your body to produce its own collagen. So it is something that can be used, but you have to be very careful because it is not reversible. Once put in, it's there and it's going to, because it's injected in a highly liquid form, the PLLA molecules sediment out in the area that you've injected in, and then they cause collagen formation. So what you will see initially will be the volumizing effect of the saline in which the PLLA was mixed. But as the saline gets absorbed, patients will say, oh, it went away. But then it comes back as the PLLA causes formation of collagen. But although I do like PLLA a lot, it's quite expensive and it has that problem that it cannot be easily reversed. The other filler that is in common use today is Radiesse, which is also a filler that I like a lot because it is has calcium hydroxyapatite uh, molecules within it, which is essentially bone. So basically, the best use of Radiesse is to put it right to build up the cheekbones, to build up the chin, to build up the jawline, and it will almost feel like bone after a while. It can also be used in a very highly dilute form for its biostimulant properties, because it is one of the few fillers that has biostimulant properties. So those are the categories of fillers that are in predominant use, and in generic terms, they're PLLA, hyaluronic acids, and Radiesse, which really doesn't have a competitor, and no one else makes a competitive product to Radiesse. And that's largely because it's unique, and I believe they have a patent on the manufacturing, whereas hyaluronic acid is a biologic, and companies cannot have a patent on something that occurs in nature. So different companies are able to market and manufacture hyaluronic acids. So today I'm here with my patient Victoria, who is very interested in looking good. So I'm here in my office with Victoria, who is a patient of mine and a model. She's been modeling for 30 years, and we were talking about fillers, and so she has extensive experience with fillers for facial rejuvenation. So when did you first start using fillers, Victoria?
So about 30 years ago, I went into dermatologist's office or something, and I saw an advertisement for Paris Lip. That's how the collagen came out. It was called Paris Lip, and you came in, you got a test because it was bovine, which is cow, um, and if it was negative, the dermatologist would inject at that time this thing, and it was quite painful. I remember, and quite lumpy, but it was very exciting because it's the first time. It was the bee stung lip. That was kind of the effect, the bee stung lip, and that, because it was lumpy and it left kind of strange holes. It didn't take. I remember I did that for a while. Then the hyaluronics came out, and the
So
original
I
one.
love how they market these
Yes.
things. The Paris lip.
Yes.
They're not telling you that we're taking cow skin and injecting it into your skin. They call it the Paris lip. And it's saying the bee stung look. And
Yeah.
this has become very popular in certain groups, very large, pouty lips, which is not natural, because in my view, the entire face should be one, it should look natural, and I really discourage patients from that bee stung look. Sorry to interrupt.
It's okay. Well, there was a certain evolution to that. That was kind of a big thing. So it was marketed on the runways, a beast on look. Then the hyaluronics came out and were slowly replaced. And I remember it was I think it was Juvederm and I forgot the other one.
The very first hyaluronic was Restylane.
Restylane, that's it, Restylane. And then there was Restylane, something Restylane Light, or there's a variation on Restylane. And some of them I remember were a little bit better, and the doctor started to use them more to outline the lip and inject like in the philtrum and more of an, that peak, the Adam's peak. And so it evolved from the bee stung kind of look to more. But I was doing it for years. It was very popular. It was the same era when people would, perm their hair, and they would also pluck out all the eyebrows. So that was kind of the look. But it evolved again as fashion evolves.
So Restylane was the first hyaluronic, and all the hyaluronics have different properties. And the hyaluronic acids work because they are water-loving, hydrophilic. And the problem with Restylane was that it was extremely hydrophilic. And I would always tell the patients, this is what you're going to look like when you're finished, but tomorrow morning the hyaluronic acid is going to attract water, so your lips are going to look much bigger, but don't freak out, it will come down. But sure as night follows day, the next morning we get a panicked call from the patient saying, my lips are huge, what did you do? And you had to talk them down. So the hyaluronics do have different physical properties. Restylane is not much used anymore, and the newer fillers, they are less hydrophilic. So basically, what you inject is what you get. You will get some swelling just from the trauma of the needle, just like getting punched in the face, you swell. But the swelling is from the injury caused by the needle and not from the hydrophilic properties of the filler. Sorry, what were you saying at that point? I lost my train of thought.
You're right. They would swell up so much, and it would be such a difference. Like the first week, they would be huge. I remember doing a lot of TV, and people were like, "Your lips are," but then they would like over time, where there was a big difference the first 2 weeks, and then as time went by, they would sort of go down. But again, there was an evolution, and then over time, the surgeon started to inject the smile lines. I remember. And then eventually also like this triangle zone. So there was kind of an evolution of fillers just from lip to other portions of the face, like around the lip and then under the eyes over time.
So the way I think of fillers is that they have to be used very accurately to harmonize the face. And that means that, and patients will come in and they will say, I want to look better. And they will typically hold here and lift here. And I say, well, what you're looking at is like the lifting of the face, which can be done with the fillers because what I call it is a hydraulic lift, because you're injecting under the skin to lift the skin and put it in the position you want it. So that is really the best way to think of how fillers work, that you are hydraulically lifting the skin in very specific places to give the desired features. So when you're lifting the face and you're trying to make a whole natural looking face, the first place I look actually is up here at the temporal fossa.
And I know you've injected
yeah, so you see, by lifting here, now she doesn't have much lift available because we have put Sculptra, which is my favorite thing to put. But as you get older, you lose the fat and the volume in this area. And then you get a cadaveric look where you get a sunken look in here. And the older you get, the more cadaveric it looks. So patients understand this and they're having this volumizing here as one fairly early on, because the question always is, when should I start fillers? And the answer is that when you don't like what you see in the mirror, that's the time to start.
And when you hear a lot of this Ozempic face, right? Ozempic face. A lot of people who lose weight rapidly on semaglutide, right? You tend to get the cheeks here sunken in, right?
Because they're losing fat, and when you lose fat, the body does not give the fat up selectively. If you think about this in terms of weight loss, when you lose weight, everyone will tell you she loses it from where she doesn't want to lose it. And when she puts on weight, she puts it on where she doesn't want to put it on. And this is explained by the concept of high and low affinity fat receptors. Not all fat cells are the same. some fat cells are screaming out, come here, when there's fat in the blood. And they hold on to that fat tight. So when you lose weight, you have to lose the fat from your low affinity fat receptors. But having fat is not a bad thing, as the patients who've been taking Ozempic and now have Ozempic face understand. Because fat is what gives the fullness and the appearance of youth to the face.
And that's what I noticed after my pregnancies with the weight loss, is where I lost it is this triangle right here, right? So that's where you tend to also put right under the
So
eyes.
that is where your low affinity fat cells resided.
Yeah.
And that's true for most patients.
Right here. Right?
So when you want to rejuvenate a face, you want to recreate the beautiful structures of youth. One of those is the high cheek, which as you age, this begins to descend, and you see with descent, you get these deep nasolabial lines. And when patients come in and say, oh, I hate these nasolabial lines, and doctors inject directly into those lines, that's probably not the correct thing to do, because this was not the problem. The problem was this coming down and causing the deepening of it. So what you really need to do is do a hydraulic lift by injecting filler right here. So this will lift the entire cheek up and will also soften the nasolabial line, which is what the patient complained about when she first came in. But then you have to explain to her the harmony of the face, which is why you need to restore the volume of the cheek, and that will recreate what she wanted.
And I know people will tell you, oh, I just want a little bit in my smile lines, but that doesn't work like that,
That
right?
doesn't work like
You
that.
have to harmonize the face, and so there's a certain amount.
Yeah. So when people say, I just want a little bit, it's problematic because most patients need much more filler
Than they think.
And it is an economic issue because the fillers come in 1 cc syringes, which is actually why I have returned over time to injecting more fat in the face, because economically it works out better for the patient. So
and it is more lasting, right?
And that's the other thing.
Because with me, I know hyaluronic acid because I work out so much and I sweat, and I tend to, like, fillers only last about 4 to 6 months with me, like the hyaluronic.
So that's less than what is advertised. That is less than the average patient. Typically, we tell patients 8 to 12 months. But if a patient is a high hyaluronidase producer, those hyaluronics will go away much, much faster. And on the other hand, if they're a low hyaluronidase producer, they will get much more longevity out of their filler.
I know that the trend definitely for big lips have changed, and I've asked you to dissolve my fillers in my lips.
Yeah, fashions change. And when Victoria first came to me, she wanted more filler in her lips. And I told her she was not thinking straight because she already had big lips, and it would be just disproportionate to her face because she has fine features, she has classic European good looks, and to have huge bee-stung lips that you saw. And in fact, I've done quite a lot of dissolving of fillers.
A lot of celebrities dissolved them. I saw Lisa Rinna, who had big lips. So you see the celebrities. It's like anything, it was a trend.
And that's because fashion changes. But you have to be careful what you do to your face because very often it's not possible to undo it. Many years ago, there was a big trend for the hollowed out, sunken cheek look. And that was achieved by taking out the buccal fat pad. And then all these patients ended up with, it was the look was in for about 2 years, I think.
Yeah, with the
And
on the modeling runway it was
on the
popular
modeling
too.
runway, that sunken look, and then 2 years later, that look was gone. So I always advise patients to be very careful
Well, that's
about
what's
what
good
they see in
yeah.
the catalogs and on the runway and now on social media, because what's in today may not be in tomorrow.
That's what's good about hyaluronics is that before you put fat in, you could put hyaluronic in to see if a patient likes the look, then you can then put a fat.
Yes. I never do fat to the face first because I'd like to use hyaluronics to give the patient an idea of what they're going to look like, and then we can do. Because we can inject hyaluronics and fat to smooth out the jawline, to decrease the submental fold of the submentum, and we can also, when patients have jowling or marionette lines, you can fix the marionette lines with fillers. So this has been the episode on facial rejuvenation with fillers. We're going to have another episode on what Botox does and does not do, because newbies to facial rejuvenation always come in and say, I want Botox. And then when you tell them the limitations of Botox, they're always surprised because they think Botox can do much more than what they thought it could do. So we'll see you soon on another episode of Dr. Deb on anti-aging and wellness. Thank you for viewing this episode. Thank you.